In India, lung cancer accounts for 5.9% of all cancer and 8.1% of all cancer-related deaths, where the prevalence of smoking in patients with lung cancer is nearly 80%. Now, it is important to understand the current state of lung cancer in India and the deaths related to it. Not just that, let's understand on how much it is directly related to smoking.
So our numbers are much less as compared to the Western countries because smoking has been the most important factors among all the factors. Smoking is the important factor for lung cancer. But what we have seen recently, the number of lung cancer cases in India are going up, though they are not as high as the Western countries. As in metros, the incidence of smoking is going up. Yes, we do have a better diagnostic test modalities available, so that is also a contributing factor. But so far in last many decades, smoking has been the important factor.
Where the cases of lung cancer caused by tobacco are increasing at a faster pace. But there are some states in particular who are at a higher risk.
Thanks to the government, they are now coming up with the statistics regularly in India, which was not possible before. So every 5 years, 10 years, they look at the surveys, but our statistics are still getting better. Most of the time when the death happens, it is not documented properly. The numbers are more, both incidence as well as mortality. Mizoram is the number one country, Mizoram. And there is a clear-cut correlation between the tobacco and cancer incidence as well as cancer death pertaining to lung cancer. So the Mizoram numbers are 3 times more as compared to the overall median of the country.
The youth of our country are at a higher risk of developing lung cancer, that too at an early stage. And the reason, it is tobacco.
The overall cancer happens at older age. But in India, when we talk about lung cancer, the lung cancer median age of occurrence is 10 years earlier as compared to the Western country. Now, the second problem is in India, the average age of population is 28, 29. So we have no young productive population. We are number one in terms of the population, so overall population. So we have a large number of young youths. And what is alarming in my practice, I see very young patients are coming up with lung cancer, younger than me. I have seen patients very young, in their 20s, 30s, coming up with lung cancer.
Knowing about the statistics is not just enough. It's time to step up. Not just create a difference at an individual level, but also understand the different measures and strategies created in the society to ease this process of quitting and further decrease the lung cancer ratio of our country.
So we have to understand, we have a limited healthcare facility in India. The best thing which we can do is to stop smoking or exposure to the second-hand smoking. And I feel that is the most effective way, because the cost of diagnosis, cost of treatment for lung cancer is huge, and that is why there is inequality. We diagnose the patient, but most of these patients don't have money to get treated. So what we see, we can reduce the risk factors, and the most important risk factor is smoking.
It's high time we understand that tobacco is the #1 cancer killer in our country, and staying away from it is the best decision one can ever make.